So welcome everyone to our webinar today, Elder Abuse Prevention Ontario in collaboration with the Canadian Network for the Prevention of Elder Abuse, along with elder abuse networks from across Canada, which we are so privileged to have with us today, are hosting this webinar today on strategy to action, driving change across Canada. We are so pleased that you're able to join with us to learn more information about Future Us and what's happening across Canada and the progress that we have been making in the past few years to move our strategy forward. To begin, we want to provide our land acknowledgement. We acknowledge that we gather on the traditional territory of a number of First Nations and acknowledge their stewardship of this land and its waters as protectors of its natural abundance throughout the ages. We seek a new relationship with original peoples of this land that remains their home to this day. May this relationship be one of peace and friendship based on honor and deep respect. Just a few housekeeping items. Everyone's microphones and videos will be off during the presentation today. However, we do encourage you to post comments or suggestions in the chat box. And if you have a specific question for any of our presenters as we go through the session today, please post that in the Q&A box. It will allow us a better way to make sure that we don't miss your questions, because we do get many questions throughout the presentation. And if you accidentally put it in the chat box, we may give you a little reminder to move it over to the Q&A box so we don't miss your question. As I mentioned, we have our ASL interpreters with us today. They will be on screen at all times. They will be changing periodically during the presentation. You can change your screen view of the ASL interpreters as well as presenters by either the grid box at the very top of your right-hand corner of your screen to the view that you would prefer. And again, you can turn on closed captioning at the bottom of your screen. You should see a CC, and you can enable that to turn on the closed captioning. As with all of our webinars, we appreciate your feedback. So at the end of the session today, there will be a pop-up link to complete the survey, and we'll also send a follow-up email with the link as well, just asking you to take a few minutes to comment on today's session. The session is being recorded and will be posted on both Elder Abuse Prevention Ontario's website and the Canadian Network's website within the next few days, along with any of the links that we share in the chat box as well. As mentioned in previous sessions, this is a public forum, so we do appreciate your privacy and confidentiality. If you have a personal situation that you would like to speak with us about and you're having difficulties resolving, please reach out to Elder Abuse Prevention Ontario by either phone or email or our website, which will provide that contact information at the end of our session today. So just a little bit about my organization, Elder Abuse Prevention Ontario, until before I signed it over to Benedict. Elder Abuse Prevention Ontario, our vision really is to make sure that seniors are free from abuse, their rights are respected and advanced, protected. We work collaboratively with many partners across, not only within Ontario, but across Canada. Our mandate is to implement Ontario's strategy to combat elder abuse. And with that, there's 3 pillars, which I'll talk about when we get to our session in more detail, but we are funded through the Ministry for Seniors and Accessibility. So I'd now like to call on Benedict Schifflin to talk about the Canadian Network and introduce our speakers for the day.
Good morning, good afternoon, everybody. Connecting today from beautiful and sunny Vancouver, which is lovely. Very happy to see all of you. I'm checking the chat and seeing that you're coming from all over the country for this session. It's a really a joy to see you all. So I'm assuming you're somewhat familiar with our organization, but if you are not, a very brief intro. I represent the Canadian Network for the Prevention of Elder Abuse, known as CNPEA, and we are a pan-Canadian organization that works to improve awareness, supports, and capacity to have a national coordinated approach to elder abuse and neglect. So this is a lot of work about, promoting the rights of older people and doing this through knowledge mobilization, through policy reform work, and through public education efforts, as well as collaboration with organizations from across the country, which you will meet some of them today. And so that's the point of today's presentation, really, is to bring us all together and kind of talk together about what we've accomplished since 2022, which is when CNPA launched Future Us, a roadmap for the prevention of elder abuse, which was really our pan-Canadian or national engagement strategy on elder abuse. So to lead us into this conversation, I'm going to introduce Margaret McPherson, who was the engine and the architect behind the strategy. It was a labor of love and of learning for over a year, and then since then, kind of trying to advance our goals together. So if you don't know Margaret, she's a research associate at the Center for Research and Education on Violence Against Women and Children, known as CREVAC. And she designs and develops curricula and materials on a number of initiatives that are related to gender-based violence, a workplace domestic violence program, as well as the program that you probably know, It's Not Right, Neighbors, Friends, and Families for Older Adults. So Margaret, I think if you are ready to take us in, I'll let you take over.
Thank you, Benedict. And hello, everybody. It's so great to have you on the call today. I am going to, this is all about providing a bit of an update on Future Us, which was launched in 2022. I can't believe how quickly the time goes. And honestly, it was a great process in terms of we talked to people from all over the country, researchers, advocates, professionals, and came up with the strategy that that we've been working on really for the last 3 years. So this is what we're going to talk about. I just wanted to acknowledge that, it's a difficult time in the world, and, there's a sense of urgency about addressing abuse and neglect of older people. And that, whenever we look at statistics, we know that those are really conservative numbers. So with a growing population, we really do need all hands on deck and strategic thinking about how can we put our good minds and our resources together to support people of all ages, really, in creating a safer, stronger, supportive Canada. So I wanted to start just by talking a little bit about the 3 goals of the national strategy. The first one is about prioritizing prevention in every community across the country. And this is why it is first and foremost an engagement strategy. We want to touch every person and say, you have a role to play, and here's the role you can play. The second goal is around establishing and supporting elder abuse prevention networks at local, regional, and national levels. This is the infrastructure that connects us, that allows us to share our ideas and support each other. And it reaches or could reach all across the country. And so that's why it's one of the goals. The third goal comes from research over the years that has talked about how important public education is. It's most often neighbors, friends, family members, co-workers who first become aware of the signs of abuse or neglect, but they don't know what to do about it. And so It's Not Right, Neighbors, Friends, and Families for Older Adults is a campaign I'm familiar with. It's a pan-Canadian program. I'm going to talk about that a little later in the presentation as well. But it gives us a basis to do exactly that goal. I know it's lofty, teach everyone. But when you distribute the responsibility for safety across the back of the entire population, then we can start to talk about strategy about how to achieve these goals. This is the map that's on the Future Us website. I just want you to see that it's an interactive map. And so the pink little pinpoints there reflect the sort of the status, where we are in each of the provinces and territories with respect to our goals. And then the purple stars are the ability for people to just write in and tell us what they're working on, because we really do want to hear what people are doing. And so you can find that map on the Future Us website and add your voice to tell us what you are doing. When we think about the next 3 years, there are lots of areas to grow in. And I think that working at the municipal level is a really productive one. There's opportunities for us to align with age-friendly communities and interject prevention work into, those agendas. And, I don't know what all the provinces and territories are working on, but I know that in Ontario, every community has a responsibility to develop community safety and well-being plans. So whatever the version of that is, maybe it's the sustainability goals in your province or territory or community. What we want to do is make sure that elder abuse, gender-based violence are, priority issues in all communities. So I'm going to talk for a couple of minutes about the second goal around establishing and supporting elder abuse prevention networks. This is the picture, really, of, how to create a circulatory system across the country where you have mechanisms where you can drive information and ideas up, down, and across the entire system. So we're lucky that we have the Canadian network providing the backbone of support, really, for all the work that happens. It's our connector organization. It doesn't receive any funding, and so is dependent upon projects. And as I'm going to go through today, you'll see that that's the case a lot. But even with project funding, it's quite amazing what people are able to achieve. And so, I think we have I feel very grateful to the Canadian network and everyone who volunteered and works to keep it going. And then we have all the provincial and territorial networks that are on this call today that you're going to have a chance to hear from. And in many parts of the country, there are also local networks where you have people all volunteer. I don't know of a case where local networks receive funding, but some of the provincial and territorial networks do. So we are going to be talking about sustainability as we go today. And why are networks so important? If they're funded, if we can formalize them, they can do all of these things. They can deliver that public education that tells us, if we were to prepare people to recognize warning signs, indications of escalating risk, how to respond safely and effectively, and where to find help in their community, we would be delivering on that third goal about engaging everyone, giving them what they need. And what I know from all the years that I've been involved in this work is that people just need support, and they will step up when they see things that aren't right. The community coordination is really important as well. For the most part, networks don't provide direct service. They're more about convening multi-sectors, groups, and volunteers to work on this common agenda of prevention and to ensure a coordinated community response. One of the things we know from death reviews and inquests over the last 30 years is that the need for a coordinated community response is always on the list of recommendations. And yet that work is so seldom funded, and I would say not very well understood either in terms of what does it take to do effective community coordination. They also participate in knowledge sharing and mobilization, and there's where the Canadian network plays such a huge role as a backbone organization that allows us to, come together across the different jurisdictions to put our heads together and come up with things like Future Us. We need these ideas and innovations and the depth of experience that we have at the local, regional, and federal levels so that we can advance pan-Canadian goals. And of course, what we're really talking about here is achieving collective impact. These goals are relevant to everyone in the country. And what we are mobilizing, organizing, working to do is to equip people so that they know what role they can play and that they have support to be able to step into it whenever a moment comes to do something to advance a project. This is where we started when we launched Future Us 3 years ago. We already had, we're not starting at the beginning. There are already so many things happening. There were 8 provinces and territories that have an elder abuse strategy. 6 of them have a network. 1 province funds regional coordinators, and 4 of the networks have annualized or multi-year funding. Now, what's happened over the last little while is we're going to update this map because Alberta has added funding to their work, and PEI is going to talk about launching a network. So these are the kinds of changes that we're seeing already. So now we come probably, I think, to the best part of the presentation, where we're going to hear from each of the networks about their experiences and what they've been doing to advance the goals over the next 3 years. I think that it's really important to acknowledge that these are very different groups in a lot of ways. You know, it's like we're working on these common goals, but the ways in which networks form and function and prioritize are different from place to place. And so a pan-Canadian strategy has to be flexible and inclusive so that people can make things work for the people in their area. And so that's really what you're gonna do, is we're gonna have a little pan-Canadian look at what everybody's doing. So I'm gonna invite Sarita to come on camera. And Sarita, go ahead and introduce yourself. And I want you to talk about what's happening in Quebec.
Thank you, Margaret.
Thank you, Margaret.
I think there's an echo. So my name is Sarita Israel. I'm the coordinator of a domain of expertise to counter mistreatment of older adults. It is part of the Center for Research and Expertise in Social Gerontology, which is part of Health and Social Service establishment in Montreal, Quebec. I'm actually happy to share that Quebec has had an official action plan since 2010 to counter mistreatment. We actually started our 3rd action plan in June of 2022. What that has allowed us to do is to have a comprehensive strategy to counter mistreatment. And I'd like to share with you what that strategy and what the measures are. So the first one was to appoint a dedicated research chair, because it's clear that we have to have a better understanding of the problem if we're going to be able to detect mistreatment and respond appropriately. The second, and for me, probably one of the most important, was the appointment of specialized regional coordinators and provincial coordinators. The distinction between the regional and provincial, the provincial coordinators are the ones that have a transversal mandate for cultural communities, English-speaking communities, and there's some for First Nations communities and rural First Nations communities. Otherwise, each one is responsible for the region. This is also a reflection of the fact that there's an acknowledgement that not all regions are the same, not all populations are all the same, and they're not all at the same level in terms of what they have to respond to older adult mistreatment. The third measure, and a very important one, if we're going to talk about mistreatment, we have to have a resource that's going to help guide people to the appropriate resources. So there has been the implementation of a dedicated hotline, the elder abuse hotline, which not only answers questions from the public, but also offers professional consultation to the different interveners to counter mistreatment. Our action plan also made obligation mandatory harmonized training across the province for health and social service centers, because they're the ones that are going to probably respond to the most difficult cases. There's also harmonized terminology. And this is important because part of our strategy is to have a formal entente for the different sectors that need to work together to counter mistreatment, to have a common language by which to speak of the problem and address the problem. And finally, a little bit what you saw with the introduction of Quebec is we launch public awareness campaigns. They're done on TV, they're done through the radio to talk about mistreatment in a way that it's less sensationalized. You know, the all kinds of everyday type of situations that put older adults at risk. We also have sensitization programs that are distributed throughout the regions. So I've talked to you about the different measures, but I want to speak to the importance of these coordinators because it is them that create and support the local and regional networks. It is them that also do and ensure that the sensitization programs are, if need be, adapted and also diffused across their region, as well as the training. They also have done a profile of the regions to identify what are their specific needs, and they also create their own yearly action plan to respond to those specific needs. And finally, they're the ones that coordinate and implement the intersectorial consultation and collaboration for the region. So we've been at it for 15 years. And what this 15 years of dedication and action plans have taught us is that in order to counter mistreatment, you need the right partnerships, you need concrete actions, but also they have to be maintained because they have to be ongoing. And in order to do so, you have to invest, and not only in terms of money resources, but in terms of dedicated coordination that has leadership to be able to carry out, initiatives that are aimed for the whole province. Thank you very much.
Thank you very much, Rita. That was great. Rita and I have worked for many years on putting our heads together, so it's great to be together in this space again. So I'm going to call on next is Rayanne is going to come and talk about Ontario.
Great. Thank you, Margaret. Thanks, Sarita, for a great overview. So Elder Abuse Prevention Ontario, I gave a little bit of an introduction when we first started. So we have a strategy, as I mentioned, the Ontario strategy to combat elder abuse, which was implemented in 2003. So similar to Sarita in Quebec, we have been at this for 22 years. And again, we were actually the first province across Canada to implement a strategy to combat elder abuse. So we have come a long ways in working, as well as other jurisdictions across Canada. We are a small but mighty team. We have a board of directors that's comprised of 8 individuals from across the province. We also have a team of 8 staff, including our administrator and elder abuse prevention consultants. Consultants are regional consultants. Some are dedicated to do training, education, or to take case consults, do information and referral to individuals who will call us for support and information. And as I mentioned, we are funded through the Ministry for Seniors and Accessibility. That is our primary funding to implement the strategy. We do many things. The strategy has 3 main pillars. Similar to the Future Us, education is our priority, similar to the Future Us strategy. So we spend enormous amount of time working with our community partners and educating seniors in that capacity. In terms of education, is a huge umbrella. So we are involved in social media. You'll see posts daily, multiple posts every day. We're on all forms of social media. We have a website that we update on a regular basis. As I mentioned, we have our information and referral. So these are just some stats from last year. In terms of the case consultations, we had over 2,200 consults that were done just through our office alone, which resulted in over 3,300 referrals to different community agencies and organizations. We have numerous tools and resources which we continue to develop, and we are just undergoing the development of a new app and an e-learning platform. And similar to what Sarita said, that we support our elder abuse networks across the province as well. We have 43 active networks where we have initiated or working with Farfo, and Denise will be speaking in a minute, just talking about the Francophone Elder Abuse Network, and we've been collaborating with them for many years. And we also are working towards an Indigenous-led elder abuse prevention network as well, or networks, I should say, that are also happening. Our organization and consultants work closely with the networks to support them in their initiatives. Prior to COVID, we were meeting in person, but now we do many things virtually. And then we do training and education. This is where we spend a lot of our time to making sure that people are equipped to work with seniors who may be experiencing abuse, to recognize signs so they know what to do when they come across it, and also for seniors to educate them about prevention tips and how to protect themselves and their rights. So this is just, again, some highlights from I don't want to spend a lot of time on this because we only have a few minutes. But last year alone, we had over 250 educational forums that we spent to talk to senior groups. And that includes diverse communities, newcomers. We've also provide sessions in different languages as well. We attend seniors fairs where seniors come out in big crowds to learn more about information. We present at those information fairs. And the most recent accomplishment is our new podcast called Aging Vibrantly. And some of our guests here today that will be speaking have co-hosted along with myself on those conversations. We're going into season 2 starting in May, and we're looking forward to that. The other thing that we incorporate into our presentations is the ASL interpreters, as you'll see today, which is we want to make sure that we have our sessions accessible to all individuals. And just in terms of training, again, we do training to all sectors, multi-jurisdictional. We've from jurisdictions of justice, health, paramedics, you name it, financial institutes. We are out there doing training. We also host learning pods for our elder abuse networks to learn more in-depth information to support the work that they're doing at the community level. And we host virtual conferences annually as well. And with those trainings, we always include the It's Not Right Neighbors, Friends, and Families. And we do training specifically on the INR Train a Trainer, and our networks are then pushing that out to the communities as well. And then lastly, we do education advocacy and position papers. So, part of that Future Us strategy is around being an advocate in terms of governments, policies, etc. These are just a couple highlights, but just saying that we do consults. We just did one this morning with the FPT, Ministers Responsible for Seniors, is doing a consultation on financial misuse of older adults. We've in the past have provided input into the Retirement Home Act, the Consumer Protection Act recently, and we have position papers that we put on our website so people can see what our statements are. The most recent one is our federal election, where we had a communique about how we need our politicians to pay attention to the abuse of older adults. So I think that's my end of my talk. I think I can try to think of the session. So again, our website has many of the resources and information. Lastly, I knew there was one more slide. We have partnerships. We can't do this alone. Again, we work with everybody that's going to be speaking here today. We work closely with the Canadian Network for the Prevention of Elder Abuse. You'll just see a snapshot of some of the agencies and organizations that we work with. One of the big initiatives that we collaborate, as you can see, all the logos on WeAd. We are co-hosting, again, the World Elder Abuse Awareness Day initiatives. Again, we collaborate with the Future Us program. And we're also involved in the United Nations work, where we're a founding member of the Canadian Coalition Against Ageism. We are having a webinar tomorrow just talking about the UN Convention on the Rights of Older Persons. So sign up if you haven't done that so far. So these are just a snapshot. We are involved in research initiatives on many fronts, both provincially and nationally. So again, we appreciate the work that everybody is doing and the opportunities to collaborate in moving our agenda forward so we can prevent mistreatment of older adults across the country. Thank you.
Thank you, Rianne. I'm going to invite Denise to put her camera on. And Denise, if you want to introduce yourself and tell us about Farfo.
Okay. So hi everyone. Margaret, are you seeing me? Because I'm not seeing the little
I
square.
see you. I
Okay.
see you.
Okay, great. Okay, well, hi everyone. I'm pleased to be here to present the francophone aspect of things in Ontario. So, I'm Denise Lemire. I'm chair of the Réseau ontarien de prévention de la maltraitance envers les francophones de 50 ans et plus. So, it's the RP-MAFO. This provincial network was created and is coordinated by la FARFO, the Fédération des aînés retraités francophones de l'Ontario. I also represent the senior sector on the board of l'Assemblée de la Francophonie de l'Ontario, which represents over 850,000 francophones in the province of Ontario, including more than 250,000 adults aged 50 and over. So there's quite a population there. Francophones living in minority settings face significant language-based and systemic barrier to accessing culturally safe services. These challenges are compounded by aging, isolation, and increased vulnerability. In 2015, FARFO coordinated a province-wide workshop focused on It's Not Right, Ce N'est Pas Correct. And I worked with Margaret at that time. I don't know if she remembers,
Oh,
but
yes.
so it was quite stimulating and quite exciting for our local people across Ontario. Then in 2022, amid rising cases of fraud, scams, neglect, and abuse, as we have all seen, FAFO launched the RP-MAFO to better understand these issues and mobilize collective prevention strategies. Over the past 3 years, RPMFO has organized numerous webinars on a range of topics relevant to older adults, such as fraud prevention, ageism, financial abuse, and the Future Us initiatives, and others. Our PMFO participated in podcasts, especially in the last year, to raise awareness and foster dialogue about senior safety and dignity. Thanks to l'AFO, l'Assemblée de la Francophonie, for 6 French podcasts and one with EPO that I have worked with Benedict also. And we will continue to collaborate on the next set of podcasts. So we have a real good partnership with Elder Abuse Ontario and CNPEA. Our PMAFO delivered many presentations to inform and sensitize the public, service providers, and decision makers. And we will be continuing to do this in the next year, and I hope in the next few years, as long as the funding continues. Our PMFO's mission is clear. It is to create a space for collaboration, learning, and mobilization. We aim to understand the root causes of abuse in our Francophone communities. We aim to promote peer-led solution and local engagement, and that's very important for us. The work to be done in the local communities is not easy for us, but it is the most important phase of Future Us, as you have seen. Local organizations have to get involved to help meet our goals and objectives. We aim to strengthen advocacy for accessible French language, culturally relevant services. Through collaboration with senior centers, community organizations, shelters, legal clinics, and others, we're building a network of trust and action, one that reflects and responds to the experiences of Francophone seniors. As we move from strategy to action, RPMFO offers a model rooted in community, culture, and prevention, and we believe it can inspire change well beyond Ontario. Anyway, we hope. But this is not easy. In November 2024, the FAFO, as part of its commitment to prevention, launched a campaign urging provincial decision makers to take action on 2 key fronts for us Francophones. The development and promotion of French awareness tools. FAFO is calling for public education campaigns that include French.
Denise, sorry,
Yes.
I'm just going to ask, can you just slow down just a bit for our ASL interpreters? Thank you.
Okay. So number 1, the development and promotion of French awareness tools. FARFO is calling for public education campaigns that include French written materials, educational videos, posters, and online resources that are accessible and tailored to older Francophone adults. And number two, the creation of French language referral services. FAFO is advocating for dedicated funding to establish a French language helpline and navigation services specifically aimed at preventing abuse and connecting Francophone seniors with appropriate Francophone resources. These services would include an initial assessment, personalized referral, and continuous follow-up to ensure effective support. These recommendations align with RPMFO's broader mission to empower communities, ensure that Francophone seniors are not only informed, but also supported through concrete, culturally, and linguistically appropriate services. For the federal election recently held, FAFO sent this message to all candidates. Elder abuse is a growing concern that demands urgent, culturally and linguistically appropriate interventions in French. Prevention must go hand in hand with efforts to address ageism and must be fully integrated into public policy frameworks. That is very important. FAFO and RPMFO are also calling for the adoption of a national aging policy by the federal government. And that's the same thing for a lot of our organizations across Canada. One that responds to the growing demographic of older adults in Canada. The intersectoral and inclusive policy on aging should include comprehensive strategies to coordinate services for adults and their caregivers, especially at a local level, promote equity and access to prevention and protection services, and also ensure that Francophones aging in minority settings are not left behind. That's really important for us. Such a policy would reinforce and complement the efforts already underway at the provincial level and recognize aging not as a burden, but as a call to action for a more inclusive and respectful society. So, to end, we will continue to raise awareness, build partnership, develop local networks, and advocate for systemic change because the well-being, safety, and dignity of older adults must be a shared national priority for us.
Thank you so much, Denise. Such amazing work that you're doing.
Thank
So
you.
I'm going to invite Lisa, and if Peggy is on, to come and talk about what's happening in Manitoba. So Lisa, turn your camera on and introduce yourself.
I don't think they're here.
Oh, neither of them.
Apologies.
So many problems with, well, it could very well be a time zone thing, but Lisa Tingley is the new coordinator for the Elder Abuse Prevention Network in Manitoba. They have been around for a long time, but I don't think they've ever had sustained funding. But they do, there are people in Manitoba who are delivering presentations. There's a lot of volunteer activity that happens there. PEAM was also involved a few years ago in developing training with the credit union and to train bankers about elder abuse. And so I know that they do good work. I'm sorry they're not here. We'll have another opportunity to hear from them, I'm quite sure. This is Elder Abuse Awareness Council of Alberta, and so I will invite Jennifer to put her camera on and talk about what's happening in your part of the world.
Thanks, Margaret. Hi, I'm Jennifer Wells, and I'm the community trainer with the Alberta Elder Abuse Awareness Council, which is a little bit of a mouthful. At the heart of our approach is really a very simple, but I think a powerful idea. And that is that community knows community best. And so we believe that solutions for elder abuse really lie within the community itself. And our job is to support communities to prioritize that issue, to build strong local networks, and to ensure that older adults are getting the help they need. So really our focus is on prevention and also on responding to specific situations. So right now we have 20 communities across Alberta where our flow-through funding allows dedicated elder abuse case managers to work as part of what we call coordinated community response, or CCRs. So these case managers really work closely with local agencies and service providers and individuals to ensure that older adults receive the support that fits their unique situation. It really is a client-centered approach. So at AAC, we play a key role in connecting these CCRs. We facilitate networking. We give professional training and data collection, all in support of the Government of Alberta's strategy to combat elder abuse. And we're growing. There's going to be 5 new communities added this year. And one of our most powerful tools really is the It's Not Right program. We've been delivering that presentation since 2015, and caseworkers will often tell us that they get a surge in referrals after these sessions. So it really does raise awareness and empowers people to take action. And this year, we've been expanding that programming in a few exciting ways. We've added video subtitles to some of the videos used in the presentations to allow more accessibility for 6 different languages. Our 2 Indigenous liaisons have helped to create a version of It's Not Right that's really tailored for Indigenous communities. And now they're doing some work to make sure that there are presenters in those communities. And really, we're doubling down on trying to hit as many communities as possible. And you know, we really are very grateful to the Government of Alberta because we have funding to 2027. And really, it's this stable funding that allows us to expand the number of case managers we have, the number of CCRs, and also to launch new programs like the Safe Spaces Initiative, which offers temporary safe housing to older adults in rural areas who are experiencing abuse. That said, we know it's a shared responsibility. And if we really want to move the needle, we need to have more partners. And we're really hoping to engage municipalities because community knows community best. Thank you.
Thanks so much, Jennifer. Yeah, I'm always inspired when I hear all the work that's happening really in every community. It's quite heartening. Karen, do you want to turn your camera on?
Just a quick interruption. Lisa joined us. Would it be okay to circle back to Lisa right now?
Sure.
Thank you.
Hi, Lisa. Good to see you.
Hi, I'm so sorry.
It's
So
okay.
sorry.
No, nobody's perfect, Lisa.
Yeah, I have some technical difficulties, but we're back on board here, so it's all good. Thank you so much for the opportunity to be here today and to talk a little bit about what's happening in Manitoba. So just letting you know, Manitoba has an elder abuse strategy. It's approximately 10 years old, so we're hopefully going to see some updates to this in the near future. We just had a new seniors strategy developed, and elder abuse is a key component in this. So we're excited at getting some of this work done. As Rianne
Lisa?
said, yes?
Lisa, sorry, I didn't mean to interrupt you. Can you turn your camera on?
Sure. It tells me it's disabled by the host. So I may need someone to turn it on for me. Oh, there we
So many
go.
ways to
My
fail.
video. There we
you
go.
go.
Hi, nice to see everyone. As Rianne mentioned about their organization, we are a very small organization. We have a team of 1 with several volunteers. We work closely with our provincial governing bodies in the prevention of elder abuse. A&O Support Services for Seniors is a service delivery organization. and are in the position to do response, the Protection of Persons in Care Office. We work closely with law enforcement and clinic, who manages our seniors abuse support line, our key partners with PEAM. We do have annualized funding that allows for our coordinator to be employed 1.5 days a week. So really our main focus is on raising awareness and connecting with those organizations in the community. And so some of those initiatives that we undertake are, there's a network of community-based senior serving organizations in the province, and we are a priority partner with that organization. So we have a seat at the table when for all networking events as it relates to older adults in the province, and a chance to share resources and educational opportunities. We have a focus on service delivery at the community level. So we have a network of senior serving senior resource finders and coordinators in the province in each local community. And we connect directly with those senior resource finders to deliver presentations and share resources so that at the ground level, we're able to have information available for older adults. And then we've also put a priority on presentations for those working in healthcare who may be in a position to recognize situations of abuse. So we do presentations with Winnipeg Regional Health Authorities and the 7 different health authorities in the province, as well as presentations to students who are nursing students, healthcare aides, and these have been really valuable because when they have an understanding of elder abuse, they can have a hand in the prevention of elder abuse. So we are focused on raising awareness, but I would say that PEAM relies heavily on this national network. We don't have the budget to create ongoing tools and resources, and so we rely heavily on some of the tools and educational opportunities that are being provided by our partners. And so this network is a lifeblood really for our organization.
Thanks very much, Lisa.
Thanks.
So we'll go on now. So Karen, if you want to put your camera on and unmute yourself and introduce yourself.
Good morning or afternoon, wherever you are. My name is Karen Willey. I'm the Executive Director of the NWT Senior Society in the Northwest Territories. We're a very small organization. We consist right now of 7 board members and 2 staff. But elder abuse is one of our priorities. Elder abuse is a significant issue in the Northwest Territories, and communities are concerned about the normalization of abuse against older adults. As a result, the Senior Society has made elder abuse a priority. We know that elder abuse is a significant issue because we are responsible for the NWT Seniors Helpline, where we get calls on a regular basis about abuse of older adults. We're very lucky to be funded by the Department of Health and Social Services, both for the helpline and the elder abuse services we provide across the Northwest Territories. Historically, the NWT Senior Society has provided the It's Not Right workshops across the NWT. However, with 1 person to deliver in 33 communities, we just weren't able to meet the needs. Both the NWT Network for the Prevention of Elder Abuse and the communities expressed concern that both the inability to regularly do workshops in the communities, as well as the definitions of elder abuse and the workshop itself, did not meet their needs. As a result, we have made some changes. Now, the It's Not Right is a very flexible program, and so we've been able to still utilize some of it. The Department of Health and Social Services, De Beers Canada, which is a local diamond mine, and Service Canada Horizons for Seniors have each funded various projects that are intended to lead, to increased awareness and decrease incidence of elder abuse. We've changed our approach, as I've said, from a generalized network to a very specific network of facilitators who deliver elder abuse prevention workshops across the NWT. The NWT Senior Society trains these facilitators in a 3-day workshop in Yellowknife. We also worked with elders across the NWT, Indigenous elders across the NWT, to redefine elder abuse in words, examples, and scenarios that they understood. We will have a booklet coming out of their work very shortly. We have developed a facilitation training where 15 people currently have been trained. The purpose of this is to help ensure culturally safe and relevant older abuse prevention workshops that meet the needs of the communities. When we train them, we provide them with expert knowledge on adult education, on facilitation, and on elder abuse. But we also provide them with the opportunity to develop the materials in a way that works for their communities. Mentorship is integrated into the program to help ensure that facilitators are supported to deliver workshops in their communities. Many of the people who are trained to deliver these workshops in the communities have never delivered a workshop. And so the mentorship is key. We will go to their community and co-facilitate their first workshop. They can call us anytime. We can work with them to plan. Mentorship is a very important part of this. This enables workshops to be delivered across the Northwest Territories as needed. So they're not waiting 5 years because there's only one person delivering. 15 people have been trained to date. This approach meets the 3 goals of Future Us, which is important to the NWT, to prioritize elder abuse, to establish and support networks across the territory, and to teach everyone about elder abuse. Thank you.
Thanks so much, Karen. It's exciting. It's a lot of innovation that's been happening since I was there last. So it's great to hear about it. Thank you. So I'll invite Heather and April to put your cameras on and come and tell us about BCCRN. If you wouldn't mind with starting by introducing yourself.
Absolutely. I'm Heather Trelevin, the Executive Director of the British Columbia Association of Community Response Networks. And I'd like to introduce my colleague, April Struthers, who is our Director of Knowledge Exchange, Research and Learning. We're going to divide the presentation between the two of us because April was actually part of creating the original It's Not Right program. BCCRN started taking shape early in the 1990s with the drafting of legislation aimed at protecting vulnerable adults at risk of abuse, neglect, and self-neglect. The Together to Reduce Elder Abuse BC strategy was created in 2013, and we are very grateful to the province of British Columbia Ministry of Health Senior Services for their vision to fund elder abuse prevention and awareness building work at the community level. We have grown from the first 5 community response networks, CRNs, piloted in 1993 to more than 90 today, serving over 250 communities. In addition to the work of CRNs, we also offer public free education monthly across the province, both virtually and in person, with an army of trained presenters who deliver It's Not Right, Friends, Family, and Neighbors, and 3 other programs. And in addition, in BC, we're part of the BC Council to Reduce Elder Abuse and the BC Adult Abuse Neglect Collaborative. And with that, I'll turn it over to April.
Okay, April there?
Yes, I am.
Okay.
Hi, everybody. It's a real pleasure to be here today with people that I've worked with for some time across the country. And I have to say, if there's anything we know about this topic, it's that it takes time. It takes time to develop prevention and resources and to spread what it is that we want to be spreading across the country. And it's a pleasure also to be at this point, to be able to look back and see what's been achieved and to hear in sessions like today about what is going on and what the future holds for us. So let me talk a little bit about what's important in BC right now, and to us as the BC Community Response Network Association. Under the Adult Guardianship Act, there are formal designated responders in the province to adult abuse. But also under that legislation, we are the organization who are tasked with pulling together a response at the community level of both formal and informal responders. So we basically look at any community or any region, look at the set of possibilities of assets that we have there for response and pull them together. We pull them into focus and we create a coordinated response, as happens in many other places. But what we have then is formal responders that we're asking to step out of their siloed organizations into working collaboratively. And so there's a great deal of learning that goes on for all of us there. And collectively, over time, we then create an upstream prevention response to the issue. One of the things that we've noticed over time is that we need the ability to mobilize both urban and rural communities to do this. There's two very different ways of operating, depending on whether you're rural, as I am actually, or you're in possibly the Lower Mainland or a couple of our major cities. And that's something that we've noticed and talked about a lot. How do you be effective in those different contexts? It's also really important, we think, in BC to learn to work decolonially with our Indigenous neighbors and communities. And we've tried to do this from early on to really have a standard of good, ethical, and just work and to aim at cultural safety. And of course, the model of social change that we use, as so many others do, is the self-organized network. And this is seen to be the most effective in coordination and over time in actually changing social norms. So what's new for BC in that regard? Well, we've been conducting developmental evaluations over the last 12 or 13 years, and those are available on our website. And these have directed and redirected our work based on what we're finding out. So it's kind of a living model, and we shift and change and adapt as we need to each year. And with that, we are measuring the impact of social change networks. And I'm happy to say the model is working. And we are paying attention much more in the last 2 or 3 years to what the evaluation is saying and feeding it into our organizational learning. So we're using the information more deeply at every level of BCCRN. One of the things that we've noticed that's new is that we're still recovering from the pivots that we did during pandemic times. We know that self-organized networks in emergency situations are one of the best ways to get a whole community response. The switch from prevention of abuse to making sure that services were provided to vulnerable adults happened in the last few years, and we're now pivoting back to reestablish the coordinated response. And here that's the coordination and prevention is our product instead of helping to create safe conditions for vulnerable adults in other ways. So there is some relearning involved in that. And we are really now reinvigorating our network knowledge and the use of networks and the learning that comes out of them, restoring our ability to capture that learning, which we're hoping then to spread out to everybody else around the country. And the other thing is we've realized the impact of ageism and have been working on information and knowledge exchange on this as a key ism in our world. And it is deeply entrenched, we know. So it's something that we continue to pay attention to. And that sort of leads into the next thing that we've been talking about, which is considering the situation in the US and the world. And we can actually think about this in terms of bullying, neglect, and abuse. And we have tools to resist, to prevent that, and to move forward. So we are going to continue to bring those issues to light in the same way that we have in terms of adult abuse overall. Now, in terms of the Future Us strategy, to move forward, we have taken on the goals, but there's more work to do here in BC. We need to strengthen how much our key group of workers, our mentors, feel that they are part of a national scene. We need to make sure the goals are cascaded through our organization, and our mentors are critical to this because they work on coaching and consulting with our 90 plus coordinators around BC. And examples of the kinds of work that we need to carry on is that with municipalities. And I have an example of my local municipality on the Sunshine Coast wanting to know the numbers of older adults who may be abused. And we were able to undertake a short project along with Vancouver Coastal Health Authority and bring out what the local picture was and help to convince the municipality that this is something that they could be thinking about as well. Thank you for the opportunity to speak this morning.
Thanks a lot, April and Heather. There's lots of great information there. So I'm going to invite Kimberly and Mary to come on camera and introduce yourself and tell us about Seniors NL.
Hi, everyone. So nice to be here. My name is Kimberly Leonard. I am the CEO of Seniors NL here in Newfoundland and Labrador. And with me today is Mary Ennis. She's been with this organization for many years, and she's instrumental in leading numerous initiatives on elder abuse here in the province. And I'm happy to have her here with me today sharing this presentation. First of all, Seniors NL is an organization dedicated to supporting older adults across Newfoundland and Labrador. We're delighted to be part of the Future Us program for the prevention of elder abuse and in promoting Canada, where older adults live free from ageism, neglect, and harm. We view Future Us as a shared national vision that is driven by collaboration, prevention, and systemic change. At Seniors NL, we continue to do our part in bringing this vision to life through the fostering of meaningful partnerships, our community outreach and engagement efforts, through our information and referral service, resource development, social prescribing project that we recently sponsored, and our steering committee that oversees the work of the Newfoundland and Labrador Network in the prevention of elder abuse. At Seniors NL, we take great pride in our information and referral service, which we believe is a vital frontline resource in both preventing and responding to elder abuse. It is free, confidential, and a trusted service available to seniors, families, caregivers, and healthcare professionals all across Newfoundland and Labrador. All calls are in real time and are answered by trained peer support volunteers who offer compassionate, trauma-informed listening, providing a safe and judgment-free space to share concerns. Since we have the capacity to quickly and easily connect individuals to the right supports, resources, and services, our information and referral service is a critical first point of contact for people experiencing elder abuse and for those who simply want to learn more. We also have a robust community outreach and engagement program that plays a significant role in educating the public and creating awareness of elder abuse. And Mary will take it up from here to tell you all about how we are such a valuable support on this topic here in Newfoundland and Labrador.
Thank you, Kimberly, and hi, everyone. It's good to be here this afternoon and to see a lot of faces that I probably haven't seen for a little while. Anyway, community engagement and outreach and engagement is part of our programs here at Seniors NL. And elder abuse is a key focus of that program. Education and awareness, we offer workshops, presentations, and Let's Talk virtual sessions open to all residents of Newfoundland and Labrador. And from time to time, we get in our audience, we're joined by people from other provinces and other countries. We've created and distributed brochures, posters, fact sheets, presentations, and webinars on recognizing and reporting all types of elder abuse, including financial, emotional, physical, neglect, the whole gamut. And training, we offer information and training sessions to seniors, families, healthcare professionals, community groups to strengthen detection and response. We also offer these sessions to students. We have medical students at regular intervals, social work students, and even high school students. Future plan, we're planning a cross-provincial tour right now to deliver in-person presentations on elder abuse, raise awareness, and strengthen local prevention efforts, and strengthen our provincial network for the prevention of elder abuse, which I will just take a minute here to tell you about. As we know, elder abuse cannot be solved in isolation. It requires partnerships. We really believe strongly in partnerships. And we have developed, Seniors NL established Newfoundland and Labrador Network for the Prevention of Elder Abuse, supported by a steering committee. The steering committee is comprised of members across the province, including community representatives, local agencies and organizations, the Royal Canadian Mounted Police, the Royal Newfoundland Constabulary, Office of the Seniors Advocate, the 7 health zones in the province, Public Legal Information Association of Newfoundland and Labrador, Multicultural Women's Association of Newfoundland and Labrador, and we also have representation from Quadrangle, which is the organization whose members include the 2S LGBTQAI plus community. And this committee has made great strides in addressing elder abuse in the province. Key achievements, strategic planning. We developed recommendations for legislation changes regarding the Adult Protection Act and have been instrumental in expanding the eligibility criteria for emergency protective orders. We're happy that the House of Commons amended the Family Violence Protection Act to expand eligibility for those who could apply for emergency protection orders, and that took effect in December of 2024. Public education. We lead ongoing awareness campaigns and educational sessions on recognizing and preventing elder abuse. Influence policy. We actively contribute to provincial discussions on safeguarding at-risk adults from abuse and neglect. And we also, our vision in action includes promoting safe, supportive communities where seniors live free from harm, backed by coordinated programs and services.
Great job there, Mary, on that overview. And of course, at Seniors NL, we believe in a collaborative approach in ending elder abuse. And collaboration is really the key, as it provides opportunities to bring together community groups, government, healthcare, families, provincial and national networks such as Future Us and this webinar we're having here today, as well as older adults themselves. So we believe it's through the sharing of knowledge and best practices, as well as all the coordinated actions of all provinces across Canada, that gives us this united voice to move forward in building safer, more respectful communities. And for this reason alone, Seniors NL is delighted to be part of the Future Us National Network. We strongly believe that together we can create a future where older adults can live with dignity, free from abuse. Thank you very much.
Thank you so much
for us today.
Thank you, Kimberly. Yeah, thank you, Kimberly and Mary. And I'm going to go now. So we've been looking at the different networks, and there are a couple of places, provinces and territories that don't have networks, but it doesn't mean that there isn't work happening in these places. And so we have the volunteers who do this work in their own way. And so I wanted to invite Harry and Elliot from Saskatchewan to come and tell us a little bit about what you're working on to advance the goal.
Thank you. And I need the host to turn on my video. My name is Carrie, and I am in Regina, where I am working with a group of volunteers to do older adult abuse prevention presentations. Right now, we're making the majority of our presentations to the RCMP cadets, who are all trained in Regina. This means that we are doing at least 2 and sometimes 4 presentations per month, looking at how the cadets can recognize abuse of older adults. We talk about ageism and social isolation as 2 of the factors that contribute to the abuse of older adults. And we also speak to them about how to interact with older adults when they're investigating cases of abuse or other cases they might be working on. We also had annual Fraud Prevention Month presentations with the Regina Police Service coming in to talk to older adults and others about the latest frauds and scams that were appearing in Regina and elsewhere in Saskatchewan and the world. We have also spoken to seniors organizations, healthcare workers, including students in nursing and social work programs at the University of Regina, and churches, where we've been able to talk about what older adult abuse is using the It's Not Right framework, and then going on to talk about what older adults can do to protect themselves from becoming victims. And to a large extent, what we really focus on is older adults remaining active and engaged in their community so that they will have a network of friends and others who can support them and assist them if the need arises. So I'd like to thank the dedicated volunteers who are involved in the program. We have been doing this work for the last 30 years, and Elliot, who's going to speak next, was involved in the original older adult abuse prevention handbook that was developed in Regina.
Elliot, I think you need to unmute yourself.
Sorry, thank you. Yeah, thanks, Carrie, for that. I have been around a long time. I live in Saskatoon, and I'm a committed volunteer with the Saskatoon Council on Aging, which during the Federal Elder Abuse Initiative focused much more on elder abuse than we do now. Our main focus now is positive aging for all in an age-friendly community. And of course, the prevention of elder abuse is one of the main focuses. It was a topic, as was ageism, in our positive aging series, which are talks that we prepared that are available for presentation. Our main focus now, however, in terms of elder abuse is really is public awareness. And we do talks mainly to student nurses, again, using the INR work, which is just absolutely invaluable. And we make them to other groups as well, often people who are seniors or are involved in health-related areas. In terms of looking at where we've come over the years, I would say without question that there's a much greater emphasis now on helping people to understand how to recognize elder abuse, what the warning signs are, and how to respond, both oneself, if one should feel that one is being abused, or if one sees one. I really want to say that the INR materials are invaluable, as are workshops and so on provided by both the CNPEA and Elder Abuse Prevention Ontario are the main ones that we watch. But we're very, very grateful for that. for the larger networks. We could not be doing what we were doing without them. So thank you very much. And I have to say, it's very impressive learning what everybody is doing across the country. Thank you
It
for
is.
this opportunity.
Thank you so much, Elliot and Terry. And Olive, I'm going to invite you to unmute and put your camera on, assuming you have control over your camera, and tell us a little bit about Prince Edward Island.
Well, hi, everyone. I'm flabbergasted with everything that's going on across the country, and I can see we have a lot to learn here on PEI. I also see my colleague Tanya Craig, who I seem to have taken on her name. My name is Olive Bryantton, and I am from PEI. We are just developing a network across the province, and we're very much in the beginnings, and I can see we have big shoes to fill. We have a committee of 20. It's a very inclusive committee. We have older persons, we have students, we have community organizations, academics, and everybody is a volunteer. We have no one in a paid position. We are we are working with the national organizations, and we are also working with the Coalition Against Ageism, and our group is called the PEI Network for the Prevention of Abuse and Neglect of Older Persons, but it's combating ageism and looking at how ageism impacts abuse of older persons. Although we are small and just getting started, we have been doing some sessions on abuse and also on ageism. Actually, Tanya, my colleague, and I are doing a presentation this month on the network we're trying to develop. And what we are trying to do is develop networks across our province because it is the networks out there, the regional networks, who know what is needed in their area. So we need to tell people what we're trying to do, ask their advice on how we can do it, and work with other organizations and groups. And I think reach out to our colleagues across the country to gather information and to support what we're trying to do. We have met with government and are hopeful that as we grow and develop, government will see what's missing in our province and will look at how they can support us as we grow. As a community organization, we are bringing the voice to government and letting them know what's needed.
Amazing. Thank you so much, Olive. And so I do want to thank everybody for coming on and talking about your network. I'm going to talk just for a couple of minutes about the third goal around teaching everyone to recognize, respond, and refer, because it's another kind of the story that I wanted to paint a picture of. So this is the story of It's Not Right and how it came to be, because it is the very picture of the way we have cobbled together projects and done pieces in different parts of the country to come up with a program that really is pan-Canadian. So when It's Not Right first formed was because of the Public Health Agency of Canada. They contacted us at the centre and said, can you adapt Neighbours, Friends and Families for abuse of older adults? And we said, absolutely, as long as we can work with people attached to the Canadian Network for the Prevention of Elder Abuse. And really, that's where it started. And we spent a couple of years, we did consultations, and the It's Not Right material, just the brochures were developed. And then ESDC, the New Horizons for Seniors, put out a call for a pan-Canadian project. And we got a big grant and were able to develop all of the materials that were still being used today and being adapted now. And we were able to pilot that in every province and territory. And the interesting thing about that is we went in and did workshops years ago, and I still run into people who say, I'm still giving presentations. So that's why we wanted to have the maps, is because we want people to tell us what they're doing. We lose track of what's happening. And then the different provincial and territorial investments. So those governments also invest in projects. They fund networks, some of them, so that you see the kind of infrastructure that's available and the work that can happen. And then you see other provinces that don't have like they have some project money, or they're just working from a volunteer basis, but it's like they keep on keeping on, really, is I think the story. And then in 2021, the Department of Justice funded the Canadian Network to do this work around developing Future Us and, setting a pan-Canadian national strategy to engage everyone in the issue. And then in 2023, New Horizons again funded the NPEA to develop a toolkit to help organizations develop networks. And so, this is a story of not a single initiative, but a collaborative effort over many years and many people being involved. And, when the work is good in the sense that it draws from so many communities and perspectives, it puts down roots in these communities that we can build on. And on June 3rd, we're going to host another webinar where we're going to invite some of the people you've heard today to come back and talk about some of the adaptations that have happened with It's Not Right. In Quebec, they've done an Inuit adaptation that's absolutely amazing. You heard Jennifer talking a little bit about how some of the It's Not Right materials have been adapted into multiple languages. Karen talked about the innovative work that they're doing in the Northwest Territories. So we want you to come back and hear about how those adaptations, cultural adaptations, have been happening in more detail. I think that I wanted to come back to the map to draw attention to the fact that there are still provinces and territories that don't have networks. And, I think about a conversation we had with the health department people in Nunavut who said, we have nothing. And I thought this is really where we need to be focused. If we're going to be pan-Canadian, how can we fill in? How can there be support networks for people all across the country, right? So you see how the networks that have ongoing funding have been able to really build infrastructure. We need to do that across the country. And so, governments have a role to play. And, governments have been partners with us over the years. We've actually had members of government departments work with us, be part of our community of practice. And so partnership with government, I think, is critical. And they each also have different roles that they can play as well. So the federal government could address some of this disparity that we see, with some base funding for all of the provinces and territories to be able to sustain and grow their network. We see the provincial territorial investment. It's in the wealthier provinces and territories that we see the biggest, sort of push for this. And so we need to address, we need to get everybody up to a point where we can collaborate across the country. And then you heard a couple people talk about municipal investments as being critical. Local governments, we need to be involving them. And you need local networks because it is all grassroots work. There's lots of, opportunity for volunteers to come in and, be part of things. But we need infrastructure and sustained funding to really address this. I think ultimately we are making a case for ongoing investments that are fundamentally strategic, because look at what's grown from those initial investments. These things have long life. This is what you call sustainability. And there is greater opportunity for us to align our efforts under the three goals. The pan-Canadian potential to grow through the Canadian network, it also needs sustained funding to do more of what it's already doing. And then we talked about other opportunities, you know, to even the field a little bit and engage everyone. So it really is a call to action. Everyone has a role to play, and there are different roles that people can play. You know, you can join your network, you can start a network, you can host a presentation, you can support someone you're concerned about, but you can also meet with your local elected officials and engage them in the conversation. That's the end of the presentation itself. Rayanne, I'm going to turn it over to you. We'll be back with more updates as the years unfold, I'm quite sure. Benedict.
Yes, hi. Maybe before Rayanne talks about the evaluation, maybe a couple of quick questions, because I know we're almost at the end of the session. One person asked about that adaptation that was done in Quebec for Inuit populations, and I do believe that we'll talk more about this on June 3rd. It's not currently publicly available, is that correct? Okay. So tune back in. Rayanne will be sharing the link to join the June 3rd event if you want to learn more about this. We had two kind of questions that arose. One was a comment, but I think it's very relevant to you, Margaret, and maybe we'll start with that one. This was someone who is involved in elder abuse prevention work and who, you know, feels good about the work that they do, but did highlight sometimes there's a certain level of feeling discouraged when you don't see the numbers budging, and you know you do a lot of work and you see the good people doing the work, but you don't see a lot of change. And I know, you know, questions of like burnout, especially at grassroots level work, are very important to you. Do you have any words of wisdom on this? Oh, you're muted.
I am. I just wanted to say, I think it's really important why you need to not do this work in isolation. We need to support each other. You can see in this presentation, there are things happening, even if it doesn't feel like it. So, you know, be part of a group and, you know, we just keep on keeping on. The future of us is up to us. And so I think that we also need to celebrate the things that we achieve, and that we do recognize how difficult it is, right? But what's the alternative? We have to keep pressing for a better world.
And I see Sarita has raised her hand.
Yeah, I just wanted to say that, you know, in Quebec, we got an action plan in 2010. We started working on it in 1980, the late 1980s, and we were a group of dedicated organizations, individuals, and they didn't even want us to use the word elder abuse at presentations. They thought it was too depressing. And it took us basically, we're talking about maybe from 1990 to 2010. That's called 20 years of fighting and advocacy and convincing by many players repeating the same thing and the need. So the idea is to be connected to the other people that are making efforts, and the cause is unbelievable. So to expect results with government, or the big machines, but it just proved to me you never give up, and you do your part. At least do your part, do your niche, and keep it going, because eventually you'll break through, because the need is there, they can't deny it, and now more so than ever. So I'm just saying that it's all very nice to talk to where we are today, but it took us 20 years to get there.
Thank you. Speaking of working with government, I guess we've just had an election. There's a lot of change around the country. In every writing, there are lots of surprises. How do we capitalize on this? How can new leaders, potentially new supporters of Future Us in government, diverse government levels, be involved? What can we do to bring them to the cause? Any advice on this, Margaret or others?
Yeah, it doesn't have to be me. I do think that engaging people in conversation is really important. So meet with your local elected officials, all levels of government. I think that there are common messages we can be communicating about the importance of prevention, investments in prevention, and the alignment of this work up and down sort of the three levels of government. I think, so developing key messages is something your local networks can do as well, your provincial networks. Like, it's an ongoing conversation, but dialogue, personal relationship is fundamental.
And Sarita, I think you still have
I'm going to add one more thing, and it's like, what government needs? It needs numbers. I got to say, with them, very often it's numbers. Before we got the provincial hotline, we were running a volunteer run line, and which was like 5 days a week, 9 to 5. We all know the problem is much bigger than that. And over time, we were getting 1,500 calls, and we're saying, don't tell us that that we don't. And then we had over 100 consultations we were doing just from people that we gave training to. So it's documenting how many people are coming to your sessions, care about the problem. And I think that it is important to provide numbers and interests and do activities that reflect not only that we care, but the population cares. And I think that that's part of those big sensitization programs. They can work for us, and for the public to speak out. So yeah, numbers too are important for government officials.
Make your local elected officials aware of Future Up. Invite them to join us and to do what they can from their place of position and power to influence, to do what they can to help us achieve these goals. It's in all of our interests.
Thank you so much. We could probably go on, but I know we're going a little bit over time, and Ryan had a couple more things to say. Ryan?
Thank you. I know there was a couple questions about where we can find some of the materials for the Indigenous communities. So we will maybe try to put that information in the notes when we post the recording onto the website. So we'll try our best to answer some of the questions that were posed. Yeah, just a quick thank you for everyone for showing up and participating. This has been a great discussion. So much happening. Please fill out the evaluation forms when the link comes up on your computer, or follow up. That would be greatly appreciated. We have a couple upcoming sessions that are happening. One's tomorrow. Really exciting initiative around moving forward the UN Convention. There's been some significant advancements in that. So please tune in tomorrow. Again, same time, same place. And we have speakers from internationally that will be speaking on that. And then finally, we have our forum that Benedict is leading along with myself on dementia awareness response to abuse in later life. So we are getting the registrations out, and the link is in the chat box. So if anybody wants to participate, that's free. So it's from 12 to 4 Eastern time, or 9 to 1 in Pacific time. So I think that's all I had to say. So our comments, if anybody wants to reach out to either one of our organizations, our contact information is there, or social media, you can catch us there as well. So Benedict, any last words?
No, that's it for me. Just many thanks to everyone who spoke today. That was a long time in the making. The work that is taking place is impressive, especially when you see it laid out and you see the people behind the work. It's easy, I think, to kind of chalk it up to this sort of amorphous thing, but when you see the people and you hear their stories, I think it has a lot more weight and a lot more power to it. So I know that our network, CNPA, is much richer and powerful from also the connections and the collaborations that we get to enjoy with all of your organizations. So thank you for being a part of this, and I'm so glad you all made it today. We'll see you hopefully either tomorrow or later this month for our next webinars. And Margaret, again, thank you for facilitating this.
Thank
You're
you.
welcome.
Have a great day, everyone.
Thanks, everybody.